Hello, how are you?
Hello.
My name's Erin. I'm going to be your nurse today.
Okay.
How are you doing today?
Good.
Good. So I see that you're here for a physical today.
Mm-hmm.
All right. So what we're going to do is we're going to go through all the body systems. Okay, we're going to just go head to toe, and I'll ask you some questions, and if you don't mind, I'm going to record some data while I'm doing my assessment. Okay?
All right.
First, I'm going to wash my hands. Okay, I'm going to check your vital signs here.
Okay.
First, I'm going to check your blood pressure. Okay. Let me clip on it. Just keep your arm real relaxed. Okay. Looks good. 119/78. I'm going to check your temperature here.
Okay.
Okay, this is going to go in your ear. Okay, 97.2. Looks good. Going to check your pulse here too. Okay, good. All right. Your respirations were 20 and your pulse was 68. That's very good. Are you in any pain right now?
No.
No? No pain at all? Do you have any history of pain?
No.
Okay. All right, I'm going to check your sensation.
Okay.
All right. In your arms and legs. Do you have any history of any numbness or tingling anywhere?
No.
Okay. All right. So just look straight at me. Okay. Tell me when I'm touching you.
Okay.
Okay, where am I touching?
Left arm.
Okay.
Right arm.
Okay. Does it feel the same on both sides? Okay. Check down here. Look straight ahead. Tell me when I'm touching you.
Left leg.
Okay.
Right leg.
Okay. Does it feel the same on both sides?
Yes.
Good. Okay. All right. I have to ask you some questions that I ask all my patients. Can you tell me your name?
JG.
Okay. And can you tell me where you are right now?
At the hospital.
Good. In the month and the year?
April 2017.
Okay. And why are you here today?
For a physical.
Okay. All right. I can see that my patient is alert and oriented to person, place, time, and situation. His speech is clear. And okay. Now we're gonna I'm gonna check your vision. Okay. Do you have any problems with your vision?
No.
No. Okay. Do you have any trouble seeing at night?
No.
No? Okay. All right. So first, what I'm gonna do is I'm gonna put my finger right here. Look at an object in the distance, and then look close at my finger, and then look at the object in the distance. Okay. All right. I'm gonna take a look at your eyes. So just look straight ahead at me. I've got a bright light I'm gonna shine in your eyes. Okay.
Okay.
Good. Okay. Alright, I'm just gonna feel the skin around your eyes, okay? Tell me if there's any pain.
No.
No? Okay. There's no drainage right now. I'm gonna lower your lower eyelids so I can take a look underneath. Just look straight up. Okay, his conjunctiva underneath is pink. There's no excessive redness or drainage, and it's clear over his sclera. His sclera is nice and pink as well. His pupils are equal, round, reactive to light and accommodation. His pupil size is 3 and brisk. All right, next we're going to go on to your ears. Do you have any problems hearing?
No.
No hearing aids?
No.
Okay. Inspect his outer ears. This ear looks good. His skin's intact. I don't see any drainage coming from his ears. Okay, same with this side. I don't see any drainage, no lesions, no scabs, no scars. Take a look inside your ear here. This ear canal is clear. Ear canal is clear. I can see the tympanic membrane on both sides. It's translucent. Alright, next we're going to go on to your mouth.
Okay.
Do you have any pain from your mouth?
No.
Okay. I'm going to use my flashlight here. Okay. His lips are intact. They're nice and pink. There's no lesions or scabs present. Can you open your mouth? Stick your tongue out. Good. Say ah.
Ah.
Okay. Move your tongue from side to side. Okay. And then move your tongue up to the roof of your mouth. Good. His tongue underneath. And on top, you can relax your tongue. There's no white patches, no lesions present. His tongue is nice and pink and moist. His teeth are white. There's no decay. Okay, they're all well aligned. And let me take a look at your gums here. His gums are nice and pink as well. Gingival margins look good. I don't see any white patches, any sores or lesions present with his mouth. Okay. All right, next we're going to move on to your lungs. Do you have any shortness of breath?
No.
No. Any unusual excessive coughing?
No.
Ever? No? Okay. Good. All right. I can see that his respiratory pattern is even and non-labored. I took his respiratory rate earlier, which was 20. He is not using any accessory muscles right now to breathe. All right. Check your oxygen saturation level. Take your finger here. Okay, 99%. That's good. Looks great. All right, now I'm just going to take a listen to your lungs. I'm going to first listen to the front of your chest and then the back of your chest. Okay? Just relax and just take slow, deep breaths. Okay. Okay, all areas of his anterior lung fields are clear. There's no adventitious sounds noted. Just going to listen to the back. Okay, all areas of his posterior lung fields are clear as well. There's no adventitious sounds noted. His rate remains non-labored. All right, now we're gonna move on to your chest and your heart. Do you ever have any chest pain?
No.
No? Okay, no problems with your heart?
No.
Okay, and if you don't mind, just removing your shirt. That way I'm gonna take a look at your heart, and then we will get to your abdomen as well.
Okay.
That way I can get a better look. Okay, his skin looks intact. There's no lesions, scars present. Okay, and if you don't mind just laying on your back here. With inspecting and palpating. No pulsations, heaves, or lifts noted. Alright, now I'm just going to take a listen to your heart, okay? I'm going to listen to his apical rate at the apex of the heart. At the fifth intercostal space, left midclavicular line. Apical rate is 72. I hear S1 and S2 sounds. I don't hear any extra sounds, splits, or S3 or S4 sounds while listening to his apical pulse. Now I'm going to listen to the base of his heart at Erb's point. S2 is loudest at the base. There's no splitting noted. I hear S1 and S2 sounds. I don't hear any extra sounds. Okay. And upon inspecting his jugular veins here, looks good. His external jugular veins are flat and non-visible. I see a mild pulsation of his internal jugular veins close to his clavicle. Okay, and you can sit up, please. I'm going to take a look at his capillary refill here. It's brisk and immediate, under 1 second. I'm going to feel his bilateral radial pulses. They are even, regular, and +2 plus bilaterally. I'm just going to feel your pulses here on your feet. His bilateral dorsalis pedal pulses are 2 plus bilateral, regular, and equal. Alright, sir, I'm just going to take a look at your lower legs here. I don't see any swelling noted. There's no swelling in his feet. There's no edema present in his bilateral upper or lower extremities. Alright, now I'm going to take a look at your abdomen now. Okay, when was your last bowel movement?
This morning.
Okay, how often do you have bowel movements?
Once or twice a day.
Okay, is that regular for you?
Yes.
Okay. Any abnormal consistency in your bowel movements? Any constipation or diarrhea?
No.
Okay, and the color's brown?
Yes.
Is it? Okay. Alright, and if you can just lay back. His abdominal contour looks flat. I'm going to take a listen to his bowel sounds. Listen to his bowel sounds in all 4 quadrants for at least 15 seconds. His bowel sounds are present and active, and they are normal active. All right, I'm just gonna feel your abdomen. Okay, let me know if you have any areas of tenderness.
Okay.
Is that tender at all?
No.
No tenderness to light palpation. Just gonna feel a little bit deeper here. Any areas of tenderness there?
No.
Okay, no tenderness to deep palpation. Okay, I'm taking a look at his skin now. I can see that his skin tone is even. It's symmetrical bilateral. His hair distribution is symmetrical bilateral. With the abdomen, I don't see any areas. I didn't feel any lumps or masses. There's no scars noted as well. Okay, you can sit back up, sir. I'm going to take another look at his nail beds here. His nails are nice and smooth. Very evenly contoured. There's no clubbing noted. His skin is warm, pink, and dry bilaterally. His mobility and turgor of his skin is elastic with brisk recoil. All right, next we're going to go over the your range of motion. Okay, I'm just going to ask you to perform a couple different exercises. And do you have any pain in your joints?
No.
Any swelling?
No.
No? Okay. All right, if you could just stand up here. Okay, like that. Okay. And I'm going to have you, right now I'm going to do forward flexion. So what I'm going to have you do is just raise your arm one at a time up in front. Straight up. Good. Okay. Feel okay, and go down. Okay. And the other one. Okay. And down. Okay. He's got full range of motion to forward flexion. There's no crepitations noted. Did you feel any pain?
No.
With movement there? Okay. All right. Now I'm going to have you raise your hand, raise each arm to the side up to the top of your head. Okay. Okay. Good. Other side. Okay. Down. He's got full range of motion to abduction. I did not feel any crepitation noted. With that range of motion. Did you feel any pain?
No.
Or tenderness? Okay. All right, now we're going to do adduction. So what we're going to have you do is one arm at a time. I'm going to have you rotate it in front of your chest.
Okay.
Okay? So we'll start with this side. Okay, and down. Good. Okay. Okay, and down. He's got full range of motion with adduction as well. No crepitations noted. Did you have any pain with that?
No.
No? Okay. All right, now I'm going to have you, we're going to check your elbows. Okay, ever have any pain in your elbows?
No.
Okay. What you're going to do is one arm at a time, you're going to raise your arm up towards your chest.
Okay.
Or just to the back of your elbow. Okay. Good. And back down. Okay. And other side. All right, and down. With flexion and extension of his elbows, I did not feel any crepitation noted. He's got full range of motion with his elbows. Did you notice any pain or tenderness with moving your elbows? Okay, so now we're going to check your hips. So if you don't mind laying back down on that here. Okay, I'll move the pillow out of the way. Okay. So lay back, if you don't mind laying back just a little bit more. There we go. Okay. All right, so we're going to do hip flexion. So I'm going to have you raise one leg at a time and keep your knees straight and raise it up. Good, while keeping the other leg flat. All right, and down. Okay, and the other side. And down. Okay, did you have any pain or tenderness with that?
No.
Okay. All right. Now we're going to do hip extension. So I'm going to have you bend one knee and then raise it up towards your chest. Good. And back down. And the other one. Okay. Well, one knee's bent, his other knee remains on the table. Did you have any pain?
No.
With that, he's got full range of motion with his hips. All right, and now we're going to do the knees. So if you don't mind standing back up. Sorry, I keep having you stand up and down. All right. So what I'm going to have you do is stand over here. Okay. And I'm going to have you bend one leg, bend at the knee, and raise your leg behind you. Okay, standing on one foot. Good, and down. Okay, another knee. And down. All right, his knee flexion and extension were equal as well bilaterally. He's got full range of motion. Did you have any pain with that?
No.
No crepitus noted with those. All right. All right, sir, you look good. And that concludes our physical assessment. All right, one last thing we're going to do for the physical assessment. I'm going to have you walk to the end of the room and turn around and walk back. With him walking, do you have any pain or weakness?
No.
Okay, I can notice that his gait is smooth and effortless. And he had no problems walking. All right.